And welcome back. Well, last time that Dr. Salib was on from the Orange County Eye Institute, he brought us some very fascinating pictures of some state-of-the-art equipment that is in his office. I think we have a picture of one of those at the end, but today he's going to talk about laser cataract surgery.
Yes.
And, cataracts, as you have said before, come a lot with aging, don't they? It's not uncommon, is it?
No, in fact, it's one of the most common things that we experience as we age. It's a very natural process. Every eye has a lens, kind of like a camera has a lens that allows you to see at different distances and allows you to see in general. And with time, mostly, so age, there's a natural clumping of the proteins in the lens causing some clouding of the lens. And that starts to take away some of our fine, like the fine vision that we experience. So, for instance, we might not be able to see our writing quite as clearly, or we might have some glare when we're driving at night from the headlights or sunlight even. But it's really a very common problem. It affects about 22 million people in this country alone. It's actually the leading cause of blindness in the world.
Really?
But most people don't let it get to that stage in this country, thankfully. But by the time in your 70s, about half of us...
a good chart here.
Yeah, by the time in your 70s, about half of us will have what we call visually significant cataracts. And by the time we're in our 80s, the majority of us will have cataracts that need to be taken out, so about 70%. So I would say most people end up with cataract surgery by their 70s or 80s.
Do you find that, like many types of diseases people get, that it can be partially linked to genetics or hereditary? I know in my family, although my mom passed away a couple years ago, she never had cataracts. My father, who's 83, doesn't have cataracts. Is that something I need to look at?
Well, in fact, genetics can play a strong part in many eye problems or eye diseases, including cataracts. Some people can be born with cataracts. There's other factors that can cause cataracts, such as trauma or even diabetes can cause people to have earlier cataracts. But most likely they do, like for instance, the 83-year-old, your dad,
yeah.
He probably does have cataract, but maybe it's not affecting his vision yet.
Okay.
So most people will have a cataract starting in the earliest stages in their 50s, and up to the 70s and 80s is when it really becomes more significant.
And what are the symptoms? I mean, you show us here a clear photo and then a blurry photo. Would that happen very quickly, or over time would somebody be just saying, I need to get a heavier prescription on my glasses here. Things are looking blurrier, which of course could be the case, but...
Right, it's usually a gradual process. So the picture on the left shows an eye with a clear lens, and you have a clear picture. And then with time you get clouding of the lens, like on the picture on the right. And there the light gets splayed out and it gets scattered, so you don't have a clear image. So you might, for instance, notice that your glasses are not quite what they used to be. You might keep changing them and you still don't have the vision you like. Glare at night, again, is a huge problem, especially while driving. People stop driving at night, and I ask why. Well, they don't feel comfortable. Well, why not? Because of their vision. Or maybe you're looking at the television and you can't see the fine writing, like the writing from the scores, or maybe you're playing golf or baseball or something, or tennis, and you can't see the ball. So a lot of things you can't see quite as clearly, even people's faces sometimes.
Now, as far as removing a cataract, we're talking about obviously laser cataract surgery. Here's a good graphic here. And does this mean, the way I see it here, that you don't actually go in with and actually make an incision? The laser does it, or is there a combination of both techniques?
Well, it's kind of a combination of both techniques. So cataract surgery has really come a long way since the beginning. In the past, you had to actually use like a freezing probe to remove the cataract, and the people would stay in the hospital for 3 days. Nowadays, we use something called phacoemulsification. It's a very fancy term. All it means is that we take a probe to break up the cataract, but first we have to make some incisions in the eye with regular, surgical instruments, knives and needles to get in the eye. And then we remove the cataract and put a lens in the eye. Now, laser surgery used in cataract surgery is allowing us now to make the incisions by laser and even create the openings in the cataract and even break up the cataract and also correct for some astigmatism using the laser. So it adds a new level of precision and safety to the overall procedure.
I would also think just the comfort level of the patients, of having them sit there and basically having a light coming into their eye, rather than somebody approaching them with a small little scalpel. I don't care who you are, your eyes obviously have to be open, right? You don't put the patient asleep, so that can be quite daunting. I know it would be for me. So this procedure would just seem to calm a person much, much more.
You're right. It does help people to know that it's a laser, and it's a cool laser. It's not like a hot laser that you feel burning your eye or something. It's a cool laser, and we apply an instrument to keep your eye open, and it helps to, we have image-guided precision. Yeah, that's kind of a picture of what the laser machine looks like. And we have image-guided precision to be able to operate while looking at the image. So it's as if I'm operating kind of like with an MRI. It actually has a resolution better than an MRI. So you're having this image to tailor-make the incision, to tailor-make the cuts into the cataract. So we actually break up the cataract into smaller pieces, making it easier to remove. I had a patient last week with a very dense, a very big cataract. I used this laser procedure on him, and he was seeing far better than he would have ever seen the next day, simply because I was able to use that laser.
So the cataract can actually, it's the lens of your eye, it affects the lens of the eye, but it can actually get quite large and...
It can get very dense.
Okay.
And quite cloudy. And it does get a little bit larger. I mean, we're talking about something that's quite small, 4 to 5 millimeters in general. But this surgery, this laser, adds a new level of kind of safety and precision. So for instance, they've done studies where they've shown that you have about a 50% reduction in the amount of time and energy that you need to use with this phaco, which is that probe that breaks up the cataract, because now you've kind of pre-broken up the cataract with the laser. So, and also there's a certain kind of opening in the cataract called a capsulotomy, which is basically a circular opening in the front of the lens to get into the lens to break it up. And that was much more precisely done with the laser. 100% of the time with the laser, and if you compared it to a human doing it by hand, they were only as accurate about 10% of the time.
Yeah, I can imagine. Who benefits from a laser cataract surgery?
You know, anyone with a cataract who needs surgery, most anyone can benefit. There are some people who cannot be candidates for this. For instance, if you have certain scarring in your cornea or certain types of inflammations in your eye, you can't benefit. This is a picture of what we are actually seeing when we're approaching your eye. It's very, as you can see, it's kind of like there's a target. You could see the incisions that are outlined here. You could see where we correct for astigmatism on the top. I was actually the first surgeon in the Western U.S. to use the latest software update of this laser, and I'm only one of very few surgeons in this whole area that can use this technology. So I'm very proud of to have this at our disposal to help our patients.
Once this is done, you slip in an artificial lens, correct?
Yes.
So is that eye good to go for years, or because it's an artificial lens, you're not going to get a cataract in it again?
Right. No, you won't get another cataract. And that lens will last as long as you do. And that lens the lenses are very advanced nowadays too, allowing for a much broader, for instance, a broader range of vision, increased clarity, and just overall allowing people to maybe lessen their dependence on glasses as well.
All right, very good. So the first step, if somebody maybe believes they have cataracts, but you should have your eyes examined frequently anyway, at least once a year, correct?
Yes, I would highly recommend an eye exam at least every year, and I'll be able to tell you what your vision is, to tell you if you have a cataract and if you need it, a cataract surgery or not. Some people don't need a cataract surgery, and I tell them, well, we might as well wait till next year. But if you're having any trouble seeing, come by, I'll take a look and kind of give you your options and explain everything to you.
All right, so you can contact Dr. Salib, the Orange County Eye Institute at 949-770-13, Oh no, I'm sorry. I'm looking down here. I should be looking right there. There's the number. Sorry, I looked at a different number on here. 949-380-EYES or 980-380-3937. And there's the website as well. Maybe I need different glasses. I was looking down at the next list, so I apologize. So give Dr. Salib a call. Interesting stuff. It really is.
It's amazing. It
Yeah,
is
we both
amazing
said
technology.
The advances are just incredible.
Right.
Thank you for coming on.
My pleasure.
We'll
Thank
see
you.
you in about a month.
Yes.
All right, folks, we'll be right back. Sorry about that. These are the dime store.